The cure existed. The government knew. They watched 399 black men die anyway, for 40 years, in the name of science. Have you ever heard the full story of the Tuskegee Syphilis Study? In 1932, the U.S. Public Health Service launched a study in Macon County, Alabama, one of the poorest counties in the country, with a predominantly black population and almost no access to health care. They recruited 399 black men with syphilis and 201 without, offering them free medical care, free meals on examination days, and burial insurance. What the men were not told was that they were not being treated. They were being observed. The study's purpose was to document the natural progression of untreated syphilis in black men. Researchers wanted to track how the disease moved through the body without intervention. The men were told they were receiving treatment for bad blood, a local term for various ailments. They were given placebos and vitamins while the disease advanced. Then, in 1947, penicillin became the standard treatment for syphilis. It was effective, available, and cheap. The study did not offer it to the men, not a single one. The study continued for 25 more years. By the time a whistleblower named Peter Buxton leaked the story to the press in 1972, 28 men had died directly from syphilis, 100 had died from related complications, 40 wives had been infected, and 19 children had been born with congenital syphilis. The public outrage that followed forced the study's termination. In 1997, President Clinton issued a formal apology on behalf of the United States government to the 8 surviving participants and the families of those who had died. And this is why this story matters. The Tuskegee study is not ancient history. It is the documented, government-sanctioned, deliberate withholding of a life-saving cure from black men and for decades after that cure was known to exist. Its legacy continues today in measurably lower rates of black Americans trusting medical institutions and participating in clinical trials. The cure existed. The government chose the study over the lives. Follow us to uncover more hidden black stories. Comment if you'd like to hear more about the Tuskegee study, or the medical institutions whose abuses of black patients have shaped black America's relationship with health care to this day. We don't glorify injustice. We reveal truth. So history can't repeat itself.